It's time for another installment of Flashpoint. This week, Justin Warmoth talks with local health experts on how to stay healthy during the flu season.
Good morning, I'm Justin Warmoth. Fall is obviously a very wonderful time of the year, but it also signals something less pleasant. That, of course, is flu season, and that means that now is the time to take all the necessary steps to combat the virus. And joining us today on Flashpoint, we have Dr. Kevin Sheeran. He is the Florida Department of Health Director in Orange County. Good morning.
Good morning.
And, of course, Dr. Timothy Hendricks. He is the Florida Hospital Centricare Senior Medical Director. Good morning to both of you, and thank you for joining us on this very important topic. Dr. Sheeran, let's start with you. Obviously, flu season is right now. Who is at the highest risk of developing flu-related complications? Obviously, we always hear children and senior citizens. Is that right on track?
That is on track. I would add to that group that infants in particular are at high risk, as well as the pregnant women and those with heart disease, lung disease, and other comorbid conditions.
Okay, so a regular person at home, they're healthy, and they get the flu. What should they do?
They should take care of themselves. They should stay home, number one. They should practice scrupulous hand washing. They should drink plenty of fluids. Now, if they are really getting quite sick, in the first 48 hours, they do have an opportunity. Most of this is influenza A. They can take Tamiflu. They can call their healthcare provider, like Centricare, and take Tamiflu. All
right, and Dr. Hendricks, antibiotics like Tamiflu will certainly help combat the virus, but also something that people can do is get the flu shot.
Well, first, let me just clarify. Tamiflu is an antiviral, so people come to us at Centricare oftentimes being sick and wanting an antibiotic because they want a quick fix, when in fact an antibiotic kills bacteria, like a bacterial infection like strep throat or ear infections, but a antiviral would be what's appropriate for a virus like like the flu would be Tamiflu. Common colds, upper respiratory viruses are again viruses, and there's no treatment for the common cold, so it's important to differentiate the two initially. Now, your question regarding the flu shot, the flu shot is, now is the time to start getting your the flu shot and preparing for the flu season because it can prevent influenza.
Absolutely. And, some people worry about what the flu shot does, the side effects of that. We're going to get into both of those things when we come back, but we want to take a short break right now. When we come back, we'll talk with both Dr. Sheeran and Dr. Hendricks about the healthy habits that can help prevent the flu. Stay right here. Welcome back to Flashpoint. Today we're talking with local health experts on how you can get results against the flu. Dr. Hendricks, let's talk about the peak season for flu, when it starts, when it wraps up, and of course when it's at its most dangerous level.
Well, typically we see influenza in the wintertime. So it's going to peak anywhere between November and February. So there's several months where you'll see peak activity. Right now we're seeing a gradual slow increase in the number of flu cases coming into Centricare. So maybe about a 5 to 10% increase each week in the number of diagnoses of influenza. But when that peaks is anybody's guess. Last year we had a very late season. It didn't peak until almost middle of February, but the season lasts pretty much from now until the spring, and but now while the numbers are low is your time to go get your flu shot and get ready for that season.
And is that based upon environmental conditions or human interactions? Like, what would you kind of put the burden on that?
Well, we do know that the flu virus likes to propagate in dry, cold conditions. So that's typically when people gather together when it's cold outside. There's schools in session, so people are clustered together for the holidays. So we're going to see better conditions for transmission of the virus, and that's typically assumed to be why we see the flu season peak during the winter months.
And Dr. Sheeran, we were just talking when we came back from break before, infants, this is so important for them to stay healthy during the flu season. Talk about the difficulties of that.
So there are a lot of mechanisms that we can protect people against the flu. Number one, getting the flu shot. Number two, if we are coming down with symptoms, scrupulous hand washing with either soap-based products or soap and water, the alcohol gel-based products, covering the cough with tissue, and if you don't have that, with a sleeve or the clothing. Coughing into your elbow, staying away from the infants if you have illness, so adults, anyone who's around an infant, you should have your flu shot. You should be protected. But if you're coming down with symptoms, that's what we're talking about, cocooning the infant, protecting them. And also pertussis, all those other diseases that they can get. You're trying to protect that infant who can't get the flu shot.
And just let's talk about numbers. Let's get into that. every year we hear of some people dying, unfortunately. Every year, let's talk about last year. Do we have any numbers on how many people were infected with the virus, with influenza, and how many people died? Certainly.
So there are millions across the United States who become infected with influenza A or B in a typical flu season, and there are over 100,000, close to 200,000 who die in a typical flu season, even pediatric deaths that typically peak around the holidays and into the month of January and February. Now, up to this point, we haven't had any, pediatric deaths, but we see a peaking in these late months of the year going into December, and then, January, February is when we see this peak incidence that Dr. Hendricks has already described.
Mm-hmm. And we've been talking about it throughout this entire segment, but obviously washing hands vigorously. Talk about some other steps that people can do just to prevent, if they are at work or something like that, just wiping everything down. And
right. So your phone, your desktop, your workstation, anything that you touch, and the workplace can also, the countertop here, you can take steps to personal hygiene, or if you travel on public transit, you can have these alcohol gel products with you to help keep personal hygiene up. Right?
Absolutely. And I think a very important thing also is people want to work. They don't want to miss any days. They don't want to use a sick day. But it is very important if they have the flu to stay home.
Right. People need to stay home, and people need to keep their children at home because children are the vectors that spread this disease in the community. So we want to keep children at home. Parents need to really keep their children at home when they're sick, period. And that's very important.
And Dr. Hendricks, I think we talked about this just a short time ago, but let's touch on it again. Some of the vaccines that are available.
Well, the flu vaccine, typically in the years past, we've given what's called a trivalent, protects against 3 strains of flu, 2 type A, 1 type B. In the last few years, we've had what's a quadrivalent vaccine that's available that covers 4 strains of flu, 2A, 2B. So you have a little bit better protection there. But what's interesting this year is that we're not using the flu mist or the nasal flu spray. So for kids, because it was shown to not be that effective last year. So unfortunately, the majority of the vaccine is going to be a flu shot. But there's a variety of different forms out there. If you have an allergy to eggs, we have an egg-free version. We also have an intradermal version with the smaller needle if you don't like the needles. And also for older patients, it's important to get what's called a high dose or vaccine, where it helps with older people that may be challenged in mounting a good immune response to the flu by giving them more of the vaccine. And your doctor, if you're over the age of 65, might recommend one of those.
Okay, we were talking a little bit earlier about the flu shot. Everyone always wants to know about the flu shot, what this year's shot will do. Will it help? Will it work? What do you think about this year's flu shot? And some people have questions, obviously, about is it a cure or does it knock down the severity? Just talk about this year's flu shot.
Well, this year's flu shot is supposed to be a good match with the virus that's circulating in other parts of the world. So we're looking at, as it moves into North America and we start to see an increase in a number of flu cases, the vaccine is going to match what we're seeing that's circulating out there. Typically, the flu vaccine is very effective at preventing the flu, but it's not perfect. So I always recommend that people have that secondary source of protection, that backup, meaning you've immunized everybody around you, not just yourself. But as far as, I'm sorry, the rest of your question, I might have.
Well, some people worry about if the flu shot's going to make them sick. You know what I mean? Like, that was always like a theory, a myth that people had, like, I'm not going to get the flu shot because I'm afraid of getting sick.
Right, right. Well, that's easy because the flu vaccine is a dead virus. So what you're getting is an inactivated dead virus, so it's impossible for it to make you sick. Well, that myth comes from the fact that we're in the middle of cold and flu season, so you get your flu shot, a few days later you get a runny nose and a sniffle. It's more likely you just picked up a cold. So people have made those connections over the years, but there's absolutely no way, and study after study has shown that there is no connection between getting sick and getting the flu shot, but it definitely the benefit of preventing the flu and getting your flu shot, we know that's well established.
And Dr. Sharon, talk about where folks can get a flu shot and how much it will cost them.
So the price range is from the mid-20s to around $40 for flu vaccine. It's widely available in the communities through the pharmacies, through public health departments. For children, the public health departments have it at no cost because of the Vaccine for Children's program. that's also available through pediatricians with the Vaccine for Children's program. That's up to age 19. When they have their 19th birthday, they're no longer eligible for that, but that's a federal program. So there's no really any excuses for not getting a flu shot. It's the cost of the vaccine plus the administration cost of the provider giving the vaccine.
And Dr. Hendricks, finally, is there a deadline for this, or would you say ASAP?
Well, the deadline is you need to get your flu shot now, because we're seeing more and more people coming in. But I can guarantee you, when people start falling ill from the flu, when your friends and neighbors are sick with the flu, and when we get into peak flu season, we'll have a rush on the flu shot at Centricare. And this has happened year after year. People come rushing in December because now it's real, and I shouldn't get my flu shot. That's too late. Now is the time to get it. But we recommend the vaccine's available throughout the season, but now is the time to get it.
And this is a question for both of you. Both can answer. You can answer your own thoughts about this. What would you, I know it's unpredictable or hard to predict, how would you predict this year's flu season? Do you think it's going to be bad? Do you think it's going to be average? What do you think?
So we are looking right now at sporadic activity in Florida, but there are outbreaks in some of our Florida counties. You know, for instance, your viewing area includes Brevard County. It may include St. Lucie County. It may include Flagler County. We're seeing outbreaks in some of our Central Florida counties. So right now we're seeing, you know, moderate activity in some of your viewing area, and you cannot predict compared to last year. This is about what we expect. So I would say it's running on a pattern that's where we were last year. We can't really say at this point, is it going to be severe? Is it going to be moderate? It's where it was last year.
Okay.
Yeah, I would agree. There's no crystal ball for influenza. I mean, year after year, 20 years I've been in the community, and you just cannot predict how it's going to respond.
Bottom line, get that flu shot as soon as possible.
We know one thing for certain. There's going to be a flu season. How bad it is, you just don't know.
Dr. Sharon, Dr. Hendricks, we appreciate you guys being on Flashpoint this morning to talk about a very important topic. We'll have much more news and weather in just a few minutes. Keep it right here.